Good morning, Chris Hull, Wake Forest Baptist Health, Infectious Diseases. So it's going on into the second week of October, and we've been at COVID for a while. So for those of you who are watching the dashboards, both across the country in North Carolina, we're a little bit at a crossroads right now. Across the country, the states that are still having the most problem are the upper Midwest, and I guess you would call it near West, Nevada, Idaho, Montana. If you look at their numbers per 100,000 people, they're clearly the highest in the country, and the highest they've been, actually, for those states. So how are we doing here in North Carolina and the Southeast? Well, we had been having a decline in North Carolina, and then for a couple weeks it plateaued out, and over the last week to 10 days, actually, our numbers are starting to go up in our state. And they're not going up incredibly fast, but they're going up. Some counties in North Carolina are going up a lot faster than others. And by far and away, the counties that are going up the fastest are the counties that have the higher rural populations. And smaller towns, smaller cities. In our area here, the counties that are really starting to climb into a worrisome level is Guilford County, particularly southern Guilford County, Davidson County, to some extent Randolph, Davie maybe a little bit. And then if you go up into the mountains, Watauga County has had a really striking spike if you look at the dashboard. Watauga County might be intertwined and related to Appalachian State's outbreak there. But otherwise around here, why are our numbers going up? I mean, it's not even cold yet. And I think it largely reflects an attitude that, since we moved to phase 2.5 and now phase 3, that it's over. It's not. Phase 3 does not mean that it's over. It just means we're having a bit of an experiment and trying to open a few other things up compared to what they were. Unfortunately, you don't have to take much of a look around to know that people are stretching the rules a bit, particularly in the drinking establishments, restaurants, and bars. They're supposed to be at 30% capacity outdoors and really nobody indoors other than going in to get the drink or come out. And when you go to the establishments in our county, that's not what's happening. There's also, I think, a general feeling amongst people that, as we're getting into the little bit of the cooler weather, to move indoors a bit. Football's going on. People are watching football together, having get-togethers, and that's creating an opportunity for people to have contact with each other and then to transmit virus. Unlike earlier on in the epidemic where we were able to see certain socioeconomic areas and zip codes, right now, there's really no one ethnicity or place. It just seems to be widespread, but more so in our rural areas. Am I worried about this? To tell you the truth, yeah. I mean, we're trying to get our schools going. If cases are going up, it's going to be harder to do that. Our hospitalizations are starting to go up in our area, both in Forsyth County here at both hospitals. We were trying to shrink a little bit our COVID wards, and now we might have to actually expand them a bit. So this is the wrong way to go, and it's the wrong time because we don't want to have our numbers creeping up as we get into winter because it's a baseline that'll be higher. So I want to make an appeal to everybody that the personal distancing and the masking is still really, really, really important. And for people who are watching, if you can help me, get the word out in your churches, in your groups of friends, and your social activities. and people you know, people you email, and your social networks and online. Let people know it's not the time to let the guard down. In fact, now's the time where we really need to be doubling down on personal distancing and making sure we're using our masks. If you're going to a place and it's crowded, it's probably best just to stay out and go at another time or find another place to go or a different restaurant. And so we need to be vigilant. Fortunately, the universities and schools in the area haven't been impacted by this increase in cases yet. The only cluster that we've had in schools as of yesterday's look at the state website was in our area anyway, was in Guilford County, one school with a very small cluster. Otherwise, we haven't had any. So, let's keep the things that are important to us, but be safe about how we do it. Anyway, enough said about that. But if you can help, we need the help right now to do this. So a few things about things coming up. We've talked about Halloween a lot, so Halloween around the corner. Remember, no parties. Safe style trick-or-treating is likely okay, but keep it small into groups and houses that you know. And there's a lot out on the web on how to do that, including our archived broadcasts here. The other thing is Thanksgiving. For those of you who are planning Thanksgiving travel, I really, really stress that this is a year to have a small, intimate family Thanksgiving, and keep the number of friends and extended family down. Travel, I think, is going to be tougher around Thanksgiving this time of year because the numbers are going up all over the country. There are a few sweet spots and vacation spots yet where the numbers aren't so high and they actually will let Americans come or U.S. citizens come. And there's some places in the Caribbean. So if you really, really, really need to get away, you can look at some of the Caribbean islands. Not all of them, but some of them. And there are websites that can help you do that. So what's been in the news this week? Well, I think the big one was President Trump's illness. For those of us who are doctors, we had a little bit of an insight into Trump's illness that if you're not haven't studied medicine, it might be a little bit hard to follow. First of all, and I'll go out and say it, President Trump had COVID pneumonia. And I know there's a lot of debate back and forth in the media, did he have it or not, but he had COVID pneumonia. And that's judged by the treatments he got, when he got them, and also the observations that when he climbed the steps in the White House, he was short of breath. And you could see him using muscles to breathe that normally we don't use. And I'm not saying that. It's not a criticism. It's just that his illness was at least modestly severe. And for anyone to get hospitalized with COVID, particularly having COVID pneumonia, it takes a while to recover. Even if you get all the best medical care in the world and you get all the best drugs, you don't feel normal for a while. You're fatigued, you're tired. You can still have periods of shortness of breath, difficulty with breathing on exertion, headaches that come and go, fevers that might come and go still. Now he got some treatments that might have pushed that down and reduced the period of symptoms. But those of you out there who've had COVID know even the mild cases kind of set you back for a little while. So just to put things in perspective. So I'm going to take everyone to medical school, and this will help you understand a little bit what you've been hearing about in the news, and that is about antibodies and about symptoms of COVID and the time frame and how they come. So this chart will show you at time 0 is when you start to feel symptoms as a person. So you have to be exposed 3 to 5 days before that because that's the incubation period. So it takes some time for the virus to start multiplying. Here's the level of the virus. You can see my cute little virus that I put up here to show you what it is. So this is the level of the virus in your body. It goes up fairly quickly, and it goes up actually before you get symptoms. And that's why we keep telling people that you actually can have pre-symptomatic shedding of the virus and transmit it to other people. And I would say that appeared to happen in the White House, either from President Trump himself or from other people around him. It's a little hard to know without extensive contact tracing exactly the order of who got what. But you start to have virus multiplication, and then it affects cells in your body, in your respiratory tract, including right above the respiratory tract, above the voice box, and that below, which is your lungs. As time goes on, your body has an immune response that includes its natural immune response, but also an antibody immune response. And the natural and the antibody immune response beat down the level of the virus. And so by day 7 to 10, somewhere in there, the virus really is gone and you're no longer infectious. This is in most people. And the antibodies come up like this. So what you see in the news talking about how President Trump at the very beginning of his illness had no measurable antibodies. And that was because he was down here at the beginning of symptoms. They weren't high enough yet to measure them. So the antibodies persist for a long time, and we hope they persist forever because that might confer some immunity. Antibodies latch onto the virus, neutralize it, and take it out of your system. So the treatments that President Trump got were two treatments to reduce the level of virus. One of those was remdesivir, which inhibits the replication of the virus directly. And the other was a monoclonal antibody cocktail, where there's two antibodies that come together and then infuse that. What that cocktail does is takes your natural level of antibodies and artificially moves it over here. It gives you a big slug of antibodies early on, and then that can neutralize the virus and pull it down, while at the same time the other drug, remdesivir, keeps it from replicating directly, interferes with that. The third drug he got was steroids. Why did he get steroids? Well, it turns out that the most severe symptoms of COVID, pneumonia, organ system dysfunction, kidney failure, heart involvement, lung involvement, brain involvement, occur down here. And you say, well, there's no virus around. Why is it most severe down here? It's because it's the inflammatory response, which is a side effect of the immune response, that is making those symptoms happen. Steroids reduce that. So we give steroids here. So consequently, the time when you want to really inhibit virus is early on, when the symptoms aren't as severe. And the time you want to reduce inflammation is later on, when the symptoms are severe. And this is why people say that President Trump got treatment that a lot of us wouldn't get. Why? Because most of us don't go into the hospital right away, which is the time to reduce the virus. And there's those monoclonal antibodies that neutralized the virus and pulled it down. Then he got, that's an artificial antibody that pulls it down. There's really very few doses in the United States. And right now there's probably only about 2,000 that would be readily available. And you're not going to get those unless you've been in a clinical trial. The clinical trials are close to being closed now as they're looking at approval of the drug. So when the newspapers say that that was treatment that's not readily available to all of us, they were true. That was right. It isn't readily available to all of us. And so, but anyway, that's a little bit about what happened and how and why. So, I think he's probably out of the woods now from the most severe effects. Not totally, but mostly out of the woods. And I wish him well in recovery. The other thing that was in the news this week happened just yesterday. So our most prestigious and respected journal for medicine and science and medicine is the New England Journal of Medicine. This journal has been around since 1812. So it's been teaching doctors what to do for a very long time. And for the first time ever in the history of this journal, they put an editorial together signed by all of its editors that actually made a comment on a presidential election in politics. And the reason they did so is because of where we're at with COVID and all of the missed opportunities we've had in this country to reduce the number of infections and deaths. And so for those of you who follow medicine and science a bit, read the editorial and see what you think. I won't comment on it one way or another, but it really is newsworthy because it's the first time ever that that journal has ever done anything like that. And so it's unprecedented times. The other thing I wanted to talk a little bit about was cruise ships. I noticed the other day that our cruise ship no sail order here in North America is going to expire on the 31st of October. And the CDC has been directed and told not to reissue that order. So what's a no-sail order? Basically means that cruise ships aren't allowed to dock or embark or disembark passengers. And so that's going to expire on the 31st. So you may see the opportunities for going on a cruise after the 31st of October. That doesn't mean it's a good idea. In fact, if you wanted an environment where COVID is almost guaranteed to be transmitted, is in a close situation like on a cruise ship. And so a lot of workplaces and universities and schools are going to require 14 days of quarantine if anyone goes on a cruise. And I think almost every hospital will require that too. So still not a good time to go on a cruise. You can start dreaming about planning a cruise for maybe a year down the road and get cruise insurance. So if you have to cancel it, you can. But it's not a good time to go on a cruise. As we get closer to Thanksgiving and Christmas, and we see more of how our cases are going, we'll talk more about holidays, potential holiday travel, and family get-togethers during the holidays. It's a little early to say right now what my advice would be on that. So I think that's all I have to say today, unless there's any specific questions that have come across or anyone has any. So again, the appeal: let's use the masks. Let's stay distant. Let's avoid the crowds. Keep our get-togethers in our social situation small, and let's stay safe. I'm a little bit worried.